Live in HD from WVUE TV New Orleans, this is Fox 8 News at 6. You're watching Fox 8 News.
Time now 6:41. Cervical cancer is the third most common type of cancer found in women nationwide. Dr. Joan Cheg, a GYN oncologist at Touro Infirmary, is here with us this morning to explain a little bit more about this condition and how we can prevent it. Thank you so much for being here with us.
Thank you for inviting me.
You were telling me in the break, worldwide, this is one of the leading causes of death. So far, we're doing a pretty good job controlling it here in the U.S., right?
In the U.S., we're doing a great job. In fact, the death rate from cervical cancer has dropped by more than 50% over the last few decades.
And what do you attribute that to, those annual exams that women are supposed to have?
Absolutely. We've had a very successful implementation of Pap screening in this country.
I guess that's just one more reason why not skipping those appointments is so critical.
That's right. That's right.
And HPV vaccine, is this something that can also help mitigate, help ward off cervical cancer?
Absolutely. We now know that early detection and HPV vaccine at very early ages can help prevent cervical cancer.
So does HPV trigger cervical cancer? Is that a fair statement?
Yes. Through many years of research, we now know that cervical cancer is caused by HPV, a viral infection.
For folks, remind me of the ages for women to get that vaccine, because it's relatively young, right?
Well, you can start as early as 9. Most of us recommend that young girls get vaccinated at age 11 or 12.
And up to 26?
Up to 26.
After 26 is just not effective anymore?
No, that's not necessarily true, but that would be the target age that FDA recommends.
So for women who are older than 26, what can they do to help prevent the cervical cancer if the vaccine is no longer something that's an option for them?
Well, I think going to see their doctors on a regular basis and getting their Pap screening at a regular interval. And there are a number of risk factors for cervical cancer. So things like smoking, we know, will increase a risk for cervical cancer or HPV infections. We also know that women who have multiple partners or have sex with partners who have multiple partners, and certain medications sometimes can cause a higher risk.
What type of medication?
Well, these are women or men, really, who have weakened immunity. So medications that are being used to treat chronic illnesses like lupus or asthma, or people who've had transplants, organ transplants.
Now, what type of symptoms should women watch out for? Are there any telltale signs that, ooh, I might need to go get checked again, even though I've been having these annual exams?
That's a great question. Most women with early disease will have absolutely no symptoms. On the other hand, women who have more advanced disease may present with abnormal bleeding or bleeding after sex, sometimes an abnormal discharge that is persistent, and sometimes even urinary symptoms.
Now, the HPV vaccine, I believe it's called Gardasil. Why is that only effective in women up to 26? And how does it work? What does it do to prevent the cervical cancer and HPV?
There are actually 2 commercially available HPV vaccines now. The one that you mentioned actually targets against 4 different types of HPV, so 6, 11, 16 and 18, and these cover the most common causes of genital warts as well as cervical cancer.
And what is it? How does it prevent it exactly?
Well, it's a recombinant vaccine, so it's genetically engineered through very sophisticated methods, and it will target against the antigens that are created by the HPV in the body.
So important to take care of yourself. Go get those monthly exams, as much as we might not like them. Dr. Cheng, thank you so much for your time this morning. We appreciate it.